All right. So a little bit of background. I'm sure some of you already know Contexture is moving to a new united platform after the merge between Arizona and Colorado HIEs. So this PowerPoint and presentation today and Q&A session is all surrounded around that and information regarding the platform migration with eClinical Works. Next slide, Dina. Overview, we'll do an introduction to the integration project. Perfect. Workbook details and OIDs, next steps and questions. Go ahead, Dina. Thank you. So as I was saying, Contexture, formerly Health Current, announced that we would be transitioning to all Arizona and Colorado participants to a new single technology platform beginning in 2025. This integration will offer participants an improved HIE system performance, functionality, interoperability, identity management, reporting, analytics, and security. Our new vendor that we are working with is called Health Catalyst or KPI Ninja. We have started integration work with them now, and they need some further details for the eClinical Works connection and everyone that is connected via eClinical Works. It'll be delivered through the workbook, which we will go over. It does not apply to the inbound connection for LabCorp data feeds or portal access. So this is strictly to eClinical Works and getting data from your clinic, your providers via ECW. The planned go live for the integration is April of 2025. The initiation of the vendor participant technical calls began last year and are still continuing to this day. Next slide, please. So workbook details. You may have already seen the workbook and had that communication with your ESM. So we have this slide right here is the project info tab. The project info tab, we are asking that you guys complete row 21. It says 26, but it's cut off. So what we need from you guys that are on the call or anybody that would be involved at your agency from like a project manager, an IT person, or who would be helping be involved with the migration efforts for your provider. And if you do have a contact through ECW that would be working with. We are working with ECW as well. But they have not identified a dedicated resource for the migration effort. Next slide, please. The next tab is called the Site Info tab. The Site Info tab goes over the parent organization and name. So it would be your org name at a high level. The second column is the facility full name. So how you would like it displayed inside the portal. For example, Canton Pediatrics, how do you want it to look when somebody is looking at your data inside of our portal? The next one is the organization, the parent organization OID, the facility OID, and the MRN OID. This is all information that you can work with ECW and have them help you fill out this information along with your provider code, or if your provider code is being sent in the NPI, it's a certain number that we're looking for, and ECW should be able to provide you that information. Let's see. Please list all sites and locations that are going to be included in the feed. So if you have more than one location that is going to be sending us data, we would need those itemized out on the rows below. So if you have one on row 1 and then you have a Gilbert location or Tucson location, please itemize those all out below so we can be sure to capture that information. The OIDs must be the organization health system OID, not EHR OID assigned. So ECW usually assigns an OID and gives you a vendor OID. We need one that is specific to your agency or to your providers. The exception of the home community OID does not apply to the type of connection that we have between eClinical Works, so you don't have to worry about that home community OID. If you don't have a branched OID for your facilities, your MRNs or your NPIs, Contexture will help branch that during the project implementation. Next slide. All about OIDs. So the reason why do we ask for OIDs? We ask for OIDs as a data contributor of getting information into Contexture. An HL7 registered OID is required for the organization. Your organization may currently use a branch of your EHR OID, which could be set up currently with ECW. But we do not, and our new vendor does not support EHR vendor branched OIDs. Branched OIDs from the vendors don't create a direct attribution to the business entity providing that data and becomes compromised in the event that you would change EHR vendors. An OID registered to your organization through hl7.org creates a unique identifier for your business entity that you can use down the road in exchanging data for specific use cases, whether it's Contexture or other exchange partners that you may connect with. This way, it is a unique identifier to your organization that stays with you for the life of your organization, regardless if you're on eClinical Works or if you switch to another EHR vendor. We do not require your vendor to include their HL7 assigned OID. Rather, we will use the one that you have when you register with hl7.org. And to create the subcategories for the appropriate routing of your data within Contexture, the branching identifies your facilities, internal patient medical record numbers, external patient medical record, if different from the internal one, and a system assign provider codes or NPIs where it applies. For HL7 interfaces, that doesn't apply to you guys. For CCD interfaces, we will map the OID within our system. If you are unsure whether your organization already has a participant OID or not, you can go to the hl7.oid registry and you can do a search for your provider or your business and see if it's already registered. Because it could have happened in a previous life with somebody else and just not been shared with you all. And there is a hyperlink that it will take you to it, so you guys don't have to find that URL. Next slide, please. Next slide, Dina. Thank you. Next steps for this project. Go ahead. What to expect? So next step, an important note specific to eClinical Works. So in eClinical Works as a hub function, which means all HIEs have the same integration and connectivity information. So we have one point of entry with eClinical Works, and we get the same type of data regardless of which provider it is that agrees to sign up and send data with us. Therefore, the HIE participants do not need to contact eClinical Works for the technical sections. We have that information already. Those sections that we do need you to work with eClinical Works on, if you don't know, is the project info tab, participant project context. This will be used for email outreach efforts, identifying who will be involved, site info tab for organization name and OID information, register, and for you to register an OID through hl7.org. Delivery, timing, and processes are still being finalized between eClinical Works and Contexture. Once the migration process is formalized and all details will be shared with the participants and keep you guys up to date on where we're at. Contexture's vendor support team and HCI KPI Ninja are currently working with your EHR vendor for technical details. If your workbook is incomplete, please complete the workbook with those tabs above and submit to vendor support at contexture.org no later than 11/1 of 2024. Next slide, please. Please complete your workbook to its entirety to minimize any delays. If you have any questions or have any support needs, please reach out via email to vendorsupport@contexture.org. We also have some dedicated block times to meet with you if you have any questions to go over those. And those are at Tuesdays from 8 a.m. to 9 a.m. or 2 p.m. So please email us if you need support for additional time slots that are out of those. And we'll see how we can accommodate you guys. Please note that Contexture cannot guarantee migrating the inbound data feed to one platform if you do not submit a workbook or acquire an OID within the required timeline of 11/1. Next slide, please. And that is it. We have everyone able to come off mute if you need. Does anyone have any questions? Hey, Dorette. Yes.
Yes, I do. We submitted our workbook in 2023 before we got our OID. We registered the OID in April this year, and I submitted it. I think I gave it to Kelly. Is there any way to find out if our workbook has been populated with the OIDs that was registered, or do we have to resend the workbook all over again?
What organization are you from, Dorette?
Kyrene Internal Medicine. So it's
I'm-
KYRENE Internal
Okay.
Medicine.
I will take a look and see if we have.
Okay.
Okay. I was going to say, I can. If anything, we would, we'll probably just need an updated, just the OID information.
Yeah, we registered it in April and I sent it to Kelly. Kelly Spear.
Kelly Spear. Okay.
And I think she submitted it, so I don't know if it's been updated.
Yeah, we will take a look and get back to you and confirm that for you.
Okay.
We do have your workbook, and there is a OID in there. What we can do is we'll validate that that's the one against the HL7 registry, but I think you're good.
We're good. Okay. Thank you very much.
Okay.
And the workbook looks good. I don't have to update anything else.
I'll take a look at it right now. We got your project contact and we got your site info. Other than the only question would be, is Kyrene Internal Medicine the only location that you're sending from, or
Yeah.
are there any other sites?
Yeah.
Okay. Yeah, then
No,
it lives.
that's one.
You're good.
Wonderful. Thank you.
You're welcome.
You're all set, Dorette. Thank you. Terry, do you have any questions? You're the only other one that is not Contexture on the call outside of Dorette.
Is there a way to check and see if Grand Canyon Family Medicine has a workbook and an OID?
Yep. What is the Grand Canyon, you said?
Yeah, Grand
All right.
Canyon Family Medicine.
All right, I'll take a look.
Sandra, I'm showing it as the workbook verified and OID purchased.
Okay, I'll look at our tracker real. Grand Canyon's good as well.
Awesome. So we're all good with the workbook and the OID and everything's done.
Yep, I'm gonna verify your OID, but it looks like a registered OID, so I'll do that really quick. You're good. Awesome. Thank you.
Thank you.
Wonderful. So thanks for showing up this morning, asking all the questions. We'll be in touch with next steps as we move along in the progress of the migration efforts. Sandra, is there anything else that we?
Oh, we might want to talk about document query and the expectations for that.
Oh, yes. So the migration efforts are going to be in a two-phase, a two-phase approach. So the first phase of the migration effort is getting the CCDs from your practices inbound into the HIE. And then the second phase is the query piece. So when you're able to get documents from Contexture back into ECW, that will be at a later time in 2025. But you'll still be, what will happen in the meantime, right, Sandra, is that they will be able to, when you guys query, will it still query from HDH?
If you query today in Legacy, everything is business as usual. But once we get onto the new platform, when we go live in April, I can't say for sure that we'll be live with query at that time, but the goal is that hopefully by that time you'll be able to query us as well. But if for some reason that's still in the works, you can always log into the portal and pull in whatever you need to.
What data? Okay. Direct, yes.
Okay, I have a question. Currently, we are interfaced with the old Health Current HIE, and one of the disadvantages for that is when we make a patient inactive in ECW, Health Current was not able to see that. So we were supposed to be uploading through SFTP a list of active new patients and inactive patients every month, which is tedious. I'm wondering if the new interface can be able to tell the status of a patient um, to let us know, so we don't have to keep uploading new patients and inactive patients.
Dorit, you're talking about your patient panel for your alerting, correct?
Yes.
Okay. I mean, for now, business as usual on this platform. For the new
On the
platform,
old one, yes.
the old one, yes. On the new one, if the question is, will the new platform eliminate the need for uploading a panel? I would say no, because that's completely different than the interface. And I'm not part of that team, so I don't know exactly what will change for you. But Cherie, do you know if there's been any kind of communication on what to expect for alerting or notifications?
No, at this time, I believe it's going to be the same.
Okay.
The alerts are going to be based off the patient panel.
So for discharges, for like hospital discharges and admits, are you going to send us the notifications by email like you're doing now, or would it be in ECW? Because I know ECW has the capability to have a place for notifications where it goes onto their TCM module, because we currently use the TCM module to track, but we have to manually go into Health currently if we get the alert to go and pull the patients. Will the new interface give us the notifications inside ECW without having to get the email alerts every day of who got discharged or who got admitted?
I don't believe it has that capability, but to be quite honest, I can't say for certain. I do know that we have vendors that we can trigger notifications that go straight into your EHR, like NextGen, for example, has that ability. As long as it's a HIS to HIS, right? From DSM to
Yes.
DSM, do that. But I don't think we've ever explored that option with eClinical work. So what I'm saying is, if we've never explored that option, it could be something that does work just like it does with the other vendor, but it's just not something that I don't think we've really had anybody follow through with wanting to have their alerts that way. But that's something you can certainly talk about with your engagement manager once we migrate to the new platform to see if we have the ability to do that. My thought is if we can do it today, I'm pretty sure we can do it in the future, but no promises.
Yeah, because if you have the capabilities, it would be good to kind of build it in whilst you're doing the interface, because ECW has the HIS capability, and we actually do have get records and stuff with facilities that have the HIS.
Yeah.
So that would be nice. We tried it with the old, with the current health current, but you don't have the HISP for ECW with the old current. So it would be a good idea to add it to your building and coding now. So it makes it easier.
Yeah, I would definitely get that question over to your engagement manager. Maybe this is something they can talk to the team that implements the notifications.
Okay. I'll do that.
Any other questions?
Not for me.
We appreciate your time this morning, and it's nice to know that we got we have 2 that already submitted. And if you have problems with your workbook or if you have questions, please reach out to vendor support, or you can always reach out to your engagement solutions manager. We're happy to help.
Can someone please make sure that someone emails me or gets with me, connects with me somehow on Monday when I return to the office so that I can figure out how to get the notes like we
Of
talked
course.
before this started?
Yeah. Yep, I
Yeah.
already sent out the email and they will be in contact with you on Monday.
Awesome. Thank you so much. I appreciate everything.
Yeah.
All right.
All right.
Thank you all. I hope you have a great rest of your day. Let us know if you need anything.
Thank you.
Take
Thank
care.
you. I know.
Safe travels.
Bye.
Bye.